In this lesson, we will review the entire ICD-10-CM classification system, covering all 22 chapters and the most important coding rules required for CPC and CCS certification exams. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. ICD-10-CM structure. The ICD-10-CM classification system contains 22 chapters. Codes are alphanumeric and may contain 3 to 7 characters. Each character position provides additional specificity. For example, the code S52.521A contains the chapter identifier, the category, the subcategory, and the 7th character, which indicates the encounter type. Understanding this structure is essential for accurate coding. Basic coding rules. Several fundamental rules apply to all ICD-10-CM coding. Always code to the highest level of specificity available. The alphabetic index should be used first to locate the code, but the tabular list must always be verified before assigning the final code. Coders must also follow includes notes, excludes notes, and instructional guidelines. Finally, whenever required, the 7th character must be applied correctly. Chapter 1. Chapter 1 includes infectious and parasitic diseases, coded from A00 to B99. This chapter includes bacterial infections, viral infections, HIV disease, and sepsis. A key rule for infectious diseases is that the underlying infection is typically coded first, followed by any manifestations or complications. Sepsis rule. Sepsis coding is frequently tested on certification exams. The general sequencing rule is: first, code the underlying infection. Second, code sepsis. Third, code organ dysfunction, if severe sepsis is documented. For example, severe sepsis is coded using A41 for the infection plus R65.20 for severe sepsis without septic shock. Chapter 2. Chapter 2 covers neoplasms, coded from C00 through D49. To correctly code neoplasms, coders must consult the neoplasm table in the alphabetic index. Neoplasms are classified as malignant, benign, in situ, or uncertain behavior. Malignancy rule. When a malignant tumor is still present, code the primary site of the malignancy. However, if the malignancy has been completely eradicated, coders must use a personal history code, such as Z85, to indicate a history of cancer. Chapter 3. Chapter 3 includes diseases of the blood and immune system, coded from D50 to D89. Common conditions in this chapter include anemia, clotting disorders, and immune deficiencies. For example, iron deficiency anemia is coded using D50. Chapter 4. Chapter 4 includes endocrine, nutritional, and metabolic diseases, coded from E00 through E89. This chapter includes major conditions such as diabetes mellitus, thyroid disorders, and obesity. Diabetes rule. Diabetes codes in ICD-10-CM are combination codes. They identify the type of diabetes, the body system affected, and the specific complication. For example, type 2 diabetes with diabetic neuropathy is coded as E11.40. Chapter 5. Chapter 5 covers mental, behavioral, and neurodevelopmental disorders, coded from F01 to F99. Examples include depression, schizophrenia, and substance-related disorders. When remission is documented for certain conditions, remission codes should be assigned when applicable. Chapter 6. Chapter 6 includes diseases of the nervous system, coded from G00 through G99. Examples include epilepsy, Parkinson's disease, and multiple sclerosis. For instance, Parkinson's disease is coded as G20. Chapter 7. Chapter 7 covers diseases of the eye and adnexa, coded from H00 through H59. Many eye condition codes require laterality, meaning the coder must specify whether the condition affects the right eye, left eye, or both eyes. Chapter 8. Chapter 8 includes diseases of the ear and mastoid process, coded from H60 through H95. Conditions include otitis media, hearing loss, and vestibular disorders. Similar to eye disorders, laterality is frequently required. Chapter 9. Chapter 9 covers diseases of the circulatory system, coded from I00 through I99. Major conditions include hypertension, heart failure, and cerebrovascular disease. Hypertension rule. Hypertension frequently combines with other conditions. If hypertension occurs with chronic kidney disease, use codes from category I12. If hypertension occurs with heart disease, use codes from category I11. Combination codes must be applied correctly. Chapter 10. Chapter 10 includes diseases of the respiratory system, coded from J00 through J99. Examples include pneumonia, asthma, and chronic obstructive pulmonary disease. For example, COPD with acute exacerbation is coded as J44.1. Chapter 11. Chapter 11 covers diseases of the digestive system, coded from K00 through K95. Examples include gastroesophageal reflux disease, appendicitis, and liver diseases. Chapter 12. Chapter 12 includes diseases of the skin and subcutaneous tissue, coded from L00 through L99. Examples include dermatitis, psoriasis, and cellulitis. Chapter 13. Chapter 13 covers diseases of the musculoskeletal system, coded from M00 through M99. Conditions include arthritis, osteoporosis, and chronic back pain. Chapter 14. Chapter 14 includes diseases of the genitourinary system, coded from N00 through N99. This chapter includes kidney diseases, urinary tract infections, and renal failure. For example, chronic kidney disease stage 3 is coded as N18.30. Chapter 15. Chapter 15 covers pregnancy, childbirth, and the puerperium, coded from O00 through O9A. These codes are used only on the maternal record. Many obstetric codes also require trimester specification. Chapter 16. Chapter 16 includes certain conditions originating in the perinatal period, coded from P00 through P96. These codes apply to conditions occurring from birth through 28 days after birth. For newborn records, the principal diagnosis is usually a Z38 code, identifying the birth. Chapter 17. Chapter 17 covers congenital malformations and chromosomal abnormalities, coded from Q00 through Q99. These codes may be used throughout the patient's life, even if the condition is diagnosed later. If the anomaly has been corrected, a personal history code may be assigned. Chapter 18. Chapter 18 includes symptoms, signs, and abnormal findings, coded from R00 through R99. These codes are used when a definitive diagnosis has not yet been established. Routine symptoms that are normally associated with a confirmed disease should not be coded separately. Chapter 19. Chapter 19 includes injury, poisoning, and certain other consequences of external causes, coded from S00 through T88. Most injury codes require a seventh character, A for initial encounter, D for subsequent encounter, S for sequela. Poisoning versus adverse effect. A common exam question involves distinguishing poisoning from adverse effects. An adverse effect occurs when a medication is correctly prescribed and properly taken. A poisoning occurs when there is overdose, wrong medication, or incorrect administration. Chapter 20. Chapter 20 includes external causes of morbidity, coded from V00 through Y99. These codes explain how an injury occurred, including the cause, intent, activity, and place. External cause codes can never be the principal diagnosis. Chapter 21. Chapter 21 includes factors influencing health status, coded from Z00 through Z99. Z codes explain reasons for encounters such as screenings, counseling, follow-up visits, and patient status conditions. Status versus history. A status code indicates a condition that still exists, such as transplant status. A history code indicates a condition that no longer exists but may influence care. This distinction is frequently tested on certification exams. Chapter 22. Chapter 22 includes codes for special purposes, coded from U00 through U85. The most important codes in this chapter relate to COVID-19. COVID coding summary. Active COVID-19 infection is coded as U07.1. Post-COVID conditions are coded using the specific symptom code plus U09.9. Exposure to COVID-19 without infection is coded as Z20.822. Final exam recall. Before your exam, remember the most frequently tested topics: diabetes coding, hypertension combination codes, sepsis sequencing, fracture 7th characters, poisoning versus adverse effects, Z code usage, COVID coding rules. Final message. You have now reviewed all 22 ICD-10-CM chapters, including the most important coding rules and exam-focused guidelines. With this knowledge, you are prepared to apply ICD-10-CM coding principles for CPC or CCS certification examinations. Continue practicing with coding scenarios and mock tests to reinforce your skills.